Okay, hello everybody, welcome. This is the Business Alliance for Healthy California Small Business Outreach webinar. We're going to be, hold on. My name is Dan Geiger and I'm joined by Eric Leenson. We're both the co-directors of the Business Alliance. Eric's going to be doing the bulk of the presentation. Let me just start by saying a little bit about who we are, or this is the agenda, I should say. We're going to cover a little bit about who the Business Alliance is, why we think it's so important that small businesses be part of our campaign, what we're trying to do with this campaign, what are our objectives. We're going to review a bunch of materials that we have for you, which are downloadable, that you can use in your conversations with folks. And also we'll review some techniques and tips and talking points. So I'm going to hand it over to Eric, who will get into the presentation. Oh, okay.
Okay, hi everyone. Thank you for attending this. So the Business Alliance for Healthy California was founded this year, and we have been very active in the Healthy California campaign. Right now, we're up to about 150 businesses and business leaders that have endorsed our alliance and have also endorsed SB 562. And for us, it's quite important to talk about having a business voice. And what do we mean by that? Business as a sector, as a constituency, hasn't really spoken up in favor of single-payer Medicare for all, SB 562. And in fact, we believe there's enormous potential for these businesses and business leaders to come together and make a difference in terms of what our legislative officials hear about the need for really changing our healthcare system. We are a project of the American Sustainable Business Council, and we're affiliated with Business Leaders Transforming Healthcare, which means that we are in touch throughout the country with different groups that are working on single payer, and in fact, participating kind of directly in the Bernie Sanders launch. One of our spokespeople was up there at the launch talking about the importance of single payer for business. So why is small business so important? What's really essential for us to understand is how massive this sector is in California. Right now, there are something like 3.6 million people employed in businesses that have less than 20 employees. So it's important because that's a huge voting block to begin with. We need to win those folks over because it's in their interest to support a single payer model. We need them electorally for now, and there's also another aspect which is really important, and that is that we know the large players out there, it means insurance industry, hospitals, pharmaceuticals, are going to make the case that single payer is a job killer, and that they're going to talk about up and down the street, and we know that's not true. So by virtue of organizing businesses to become a solid voice, we can at least begin to counter that argument. I might also mention, while we think small business is so important, it doesn't mean we're not reaching out to larger businesses as well. But the reality is that's more difficult, and we think small business for this period of time is really the key sector we need to reach. So what are our campaign objectives? We're actually trying to keep it pretty simple. And first and foremost is we need to identify our supporters. As I said, we want to build a really loud voice for business support, but we are sure that there are a lot of businesses, business people out there that support this idea, but really don't come forward or don't know how to register their support. So first and foremost, this gives us a method of identifying supporters with the goal over time of literally having thousands of small business supporters that we can show to legislators throughout the state are fully determined to make this happen. Then we believe the outreach is also important in terms of finding potential supporters. There are people out there who are just ignorant or not aware of the fact of how far the legislation has gone forward, and can have a voice in doing things. And lastly, and we've talked about this generally in the Healthy California campaign, we need to broaden the base of knowledge overall, even for those who are not necessarily sympathetic, because this is a form of immunization. It's a way of getting the word out there about what single payer is before we have our enemies really coming out with huge amounts of paid propaganda against it. So how do we go about doing this? Well, we have identified several ways to find supporters. First, to the extent that we can find organized groups that have regularly scheduled meetings and really provide a forum for presentation and discussion, that's ideal. So we are reaching out to Rotary clubs and to neighborhood merchants associations. And I should say that we've been contacted by a number of activists in the Healthy California campaign who have been putting us in touch with those kinds of organizations. And it's really crucial that we do this outreach. But the other piece that's equally important, more challenging in some ways, is to actually get out there on the streets and meet with small business people in their businesses. Okay, so what do you need in order to do that? Well, first of all, you don't have to be a total expert on all of the ramifications of SB 562, but you should be familiar with it, and especially with the benefits that people will achieve with a single payer system. You need to be organized. You and your group need to really be clear about what neighborhoods you're going to cover and about how you're going to divide up that territory, and keep track of whom you've met with, whom you've left literature with, and who you might want to go back to see again, because they're interested, but they're not able to make a commitment at the moment. And then lastly, and I can't emphasize this enough, is you're really going to need a lot of patience. What all of us who have been doing this have learned is it's quite difficult to actually find the business owners in their place of business. And if you do, they're very often involved in dealing with customers or dealing with other issues that don't give them much time. So it's important to be very clear about what your initial message is going to be to the business owner, so that you can gain the time and confidence on their part to want to hear what you have to say. So we have put together an information packet which we hope is useful. We're certainly open to receiving suggestions for improving it. And this small business packet is available on our website, the Business Alliance website, and it's also available on the Healthy California website. Okay, this particular flyer, and this is a two-sided flyer, we're just looking at one side right now, is really the most important item I have found for getting attention. And we purposefully made it very simple and graphic, and just hit the major points of why we think a small business owner will really be benefited by the SB 562. And it's really important to emphasize that SB 562 is very small business friendly. When we talk about the details of what the legislation is, it's crucial that they get the idea that the people that put this together are thinking about how it benefits small business and average people. It's not something that's being done just for certain large corporations or others. So we hope this is captured on the very front of the flyer. If we go to the other side of the flyer, it's the issue that comes up time and time again, which is, well, what's this going to do for my expenses? Well, what it's going to do is probably save you a lot of money. The average small business that has few employees, 10 or less employees, is spending on average about 20 to 22% of their entire payroll on healthcare. So what this chart does, and it's important to become quite familiar with it, is a graphic representation the owners can see that shows them what savings are likely to be in terms of healthcare expenditures. Now, I want to add two important pieces which aren't stated there, but keep in mind. First and foremost is that you have to be sure that you're telling folks that this is a particular way of achieving the funding for SB 562 when we go through the numbers, and that this is not yet written into the bill. But this is the one that has been proposed by a really sophisticated study that's been done on single payer in California, and this is what they're proposing in terms of using the gross receipts tax. The other thing that's important is, well, a lot of small employers may say, gee, I don't provide health care insurance for my workers, so whatever I have to pay in addition, it's going to be an extra burden for me. Well, it's important first to reiterate some of the benefits that they will accrue by having insured employees, but probably more directly of interest to the owner is the fact that a lot of the owners are, in fact, paying insurance for themselves and their families, their spouses and their children. Now, be sure to explain to them that under SB 562, they will no longer be paying premiums or copays or deductibles. And in the end, this is going to be a great savings for them because the first $2 million of gross receipts will be exempted, meaning that it's very likely for many of these businesses, they won't be paying that particular tax, and they will be receiving the benefits of the single payer type insurance. 20%. 20%. Well, if they're not paying insurance. Okay, and they will save 20% if they are covered paying insurance at this point. Okay, and then there is another flyer that goes into a little more detail about the benefits of why single payer will work for small business. And I think these arguments are pretty clear about the cost savings for employees. It's the right and necessary thing to do. It will have improved care, will lead to better workplace performance. Another really important aspect for small business is it will improve their ability to hire and to retain employees, because right now they're competing against very large employers who are able to provide healthcare insurance, whereas they may no longer be able to. And lastly, it will give them a chance to expand their businesses or enter into other forms of entrepreneurship where they will already have insurance in place, and that won't become an extra burden to worry about. So the other piece of our packet, and I should add that many of these documents, the first two that we saw, are available in, of course, English, but also in Spanish and Chinese, and I believe Korean. So for those of you who are going out to neighborhoods where you have a very multi-ethnic set of business people, this should be helpful. The other thing that's included here is a sign-up sheet to become an endorser of the Business Alliance and of the SB 562. And it's really important to try to capture the endorsement, because really that is one of our basic goals, is to identify supporters and get them officially on board. Now, we understand that many of you work with different healthcare groups, some of which have been around a long time. And of course, it's fine for them, the business owners, to be part of that group as well. But this gets back to the idea that we need a strong voice of business, and that if we can really magnify and amplify the group that's we have of endorsers, it's going to really benefit the entire campaign. So we encourage folks to fill this out. There are several boxes that people can look at and, explain what they feel comfortable with, whether they want to, just become an endorser, but if they're willing to speak out to their state legislator. So what we're doing is keeping records of the business owners by zip code, by assembly and Senate district, so that as you organize efforts to meet with legislators, we hope to be able to provide to you a large number of business people that can accompany delegations to meet with legislators. Right now, we're pretty heavily skewed in the Bay Area, but we really have businesses over the entire state. And it's kind of interesting. We're now getting calls from a number of different activists around the state that want to get much more involved in setting up canvassing down in Southern California and up in Sacramento and in the Central Valley as well.
Just one thing, let me add, this is Dan. If you get these forms completed and filled out, please make sure they fill out the whole thing and check if they're willing to verify if they're willing to have their company listed or just their name. But if it's possible, what would be ideal is if you could scan this document into a PDF or an image and email it to us. That just makes everything a lot easier than dealing with snail mail. And I keep electronic records of all the commitments that are made. So if you can scan it, that'd be great. And just email it to us and we'll take care of it.
Okay, and then what has also been developed, and I want to really thank the California nurses for putting a lot of, doing the printing and design on these materials. We've prepared the substance, the content, but they've been really great in the campaign about producing the material. So we have little signs that can go into windows of the businesses that are endorsers and that want to demonstrate to the community that they're supporters. I think this is another way that a business shows they're part of the community, and I think they gain respect from the community by advocating this kind of legislation.
This is Dan. Let me just point out, we're going to give you a link to where you can download these documents. It's a single PDF with multiple pages. You can print these out if you have a laser color printer. Laser is nice. If you don't have that capacity to print them out, we have printed copies which we could mail to you via snail mail. So again, just send us an email and we can mail them to you, but it's much easier if you can just download it and print out that document.
Okay, so now let's get down to the brass tacks here, and that's the encounter at the counter. So what do you do when you go into a small business? And here's a gentleman that agreed to become an endorser and was very proud to have a picture taken with a sign that undoubtedly he put up in his window. So this is a great example. And we have been experimenting a lot. There's been a wonderful group of San Francisco Berniecrats who have taken this on as a project and have been doing this over the course of probably a month or so with a lot of experience. And we're going to be bringing several of them onto the phone during the course of this webinar to talk about their experiences and to answer your questions. But what I've seen from my experience is that it's really important, of course, to introduce yourself and say that you're part of the Healthy California campaign and want to talk about Medicare for all. Now, many times the owner isn't there and you should get a sense. If the manager is there, perhaps you want to talk to him or her, especially if they kind of indicate to you that they're, pretty much up there in terms of making decisions and will really make sure the owner gets the information. Because I think a lot of times it's easy to drop off information and it really doesn't go anywhere. But yeah, I think you'll get a sense in talking with people about how serious they are and how much influence they may have with the owner. Because in the end, we do need authorizations from the people that can represent the business to say that they endorse this. Now, I find that as I start a conversation with people, it's really good to try to ask a question that, engages them. So I like asking, do you know, or are you aware that Medicare for All legislation has passed the California Senate? And that's important because it sort of gets them thinking, wow, we had no idea. Many of them have no idea. And they say, well, gee, that's interesting. And you can kind of build on that this is a serious thing that really has legs and clout behind it. And at the same time, you can begin to ask them, well, what is it about healthcare insurance that works or doesn't work for you, for your business, for your family? What would you like to see in place? And that gives an opening to use the flyers, to talk about the benefits that single payer has for small business. And I would really use the one that we showed initially that talks about SB 562 being very small business friendly. That's the most succinct, and it also lends itself to a discussion about the financing and at the same time the savings for the business owner. So use those and ask them then if they have any questions. So the ideal takeaways are a signed statement of support, a sign for the window, a picture, if they happen to be involved with a local merchants association introduction. But let me say, these are ideal. This is what we should, try to seek. But it's not always going to happen. And just by virtue of going out there and talking to people and getting them engaged, that in itself has a tremendous amount of value. So I'm not going to go through this, but we put together some ideas of talking points, just simple phrases that I think are useful when you reach out to a business person. These sort of little, factoids that allow the people to sort of say, oh yeah, that's good, that's interesting. And again, it's probably not all that different from what were used generally in the campaign. And again, we're going to just go through really quickly the 6 reasons why, and you can't emphasize this enough. The cost savings for employers, the reduction in human resource and administrative overhead. There's less risk management involved in operating the business because you don't have to worry about how much are the insurance premiums going to rise next year. There'll be improved care and a better workplace performance. There'll be a stimulation of entrepreneurial activity. Lots of new jobs will be created. And as I said before, hiring and retention of employees will be easier, and there'll be less competition from the big guys. So here are the overall advantages. And again, I'm not going to go through this. These are the same advantages that we would talk about in the campaign generally.
This is Dan. Let me just add one point. A lot of people say, oh, this is socialized medicine, it's government control, and so on. And I think the response to that is like, well, number one, it's not government controlled medical care. It's government bookkeeping, basically, but it's a private medical system, and it gives you more freedom. So the conservatives' attack is always an attack on our freedom. This is actually real freedom. So you have much greater freedom to choose. You're not restricted to networks or anything like that. So I think freedom is a very good way to frame this. We shouldn't let them take that word from us. And here is a slide
which we borrowed from our good friends down in San Luis Obispo. And essentially, I'm not going to go through it, but it's something that you can have in your reserve to be able to talk about the financing, what it looks like in terms of the savings that will accrue because of a single payer system. And this will show how, in fact, this is financially responsible.
So I'd say the main point here is this plan would insure all Californians and for $70 billion less than we're paying now.
And again, here are some, frequently asked questions and, talk about, the way this is being proposed as being financed. A gross receipts tax of 2.3% on business revenues over 2 million and a sales tax of 2.3. These are demonstrable, reasonable ways of financing this effort. And, in the end, it will be worked out by the legislature as to what taxes or charges will be used to finance this. But this is the leading proposal at this point that we think is very friendly to small businesses. And we're here to help. When I talk about the Business Alliance, we understand that you may be going out and you're meeting with business owners. They may have questions that you can't answer very easily. And that's no problem. I mean, that's logical. So we're here. You can refer questions to our website, or, you can get in touch with us if you want us to talk to you and then you talk to the owner, or we can talk to the owner directly if you find that, of use. We also have speakers available. If you're able to set up talks with some of these merchants associations or Rotaries or Chambers of Commerce, we're more than happy to go out and make presentations. We find that these business people like to hear from people who have been involved for many years with business. We have a number of resources available, and we really want to encourage business people to meet with legislators in all the different parts of California. So, in terms of tips, I'm going to turn it over momentarily to our friends from San Francisco who've been doing this, but a couple things that seem to work quite well is go in pairs. It's, sometimes people feel intimidated about going in and trying to talk to a business owner. Really, they're just other people that have needs and will benefit from this and need to hear about it. But it can often be beneficial to work together as a way of making sure the points are covered and moving it forward. Learn from success. Now, we are going to have on our website a document that has been produced by the San Francisco folks that talk about their experiences and some of their successes. That will be on our website. And lastly, we want to suggest that you do role playing, that before you go out, you work with your partner or other people in your group where one of you is acting as the business person and the other is the activist canvassing, so that you can get a feel for what the flow might be like and what some of the questions and best responses will be. But at this point, we'd like to turn it over to Anne from San Francisco and Suzanne, who I hope is on the call as well.
So Anne, can you hear us now? I've unmuted you.
Yeah, I can hear you. Can you hear me?
Yeah. So why don't you speak for a couple of minutes and
yeah.
share with folks some stories or
okay, yeah. I try not to take too much time. My name is Anne, and I am a member of the healthcare team of SF Bernie Kratz. We do outreach to fairs, farmers markets, and festivals to individuals. We just started doing outreach to businesses in the last 2 months, and we partner with the Business Alliance for a Healthy California with Dan and Eric, and so far it's been a really good partnership. I'd just like to share a conversation I just had this afternoon doing outreach in my neighborhood. This was a Vietnamese business owner who happened to be a senior. And I'm just gonna recap our conversation. So I go in and I say, hello, I'm a volunteer for universal health care. And the owner says, where do I sign? And I say, did you know there is a Medicare for All bill introduced on the federal level too? He says, yes, I follow those things. And I say, may I ask you why you personally support universal health care? And he says, I have Medicare already. I don't have to worry. I worry about my children and their children and the future generations. So I think in my mind, you know, this is bingo. This is the kind of support we want. We started to talk about Ken Burns' series and digress on the Vietnam War. And both agree that the innocent civilians that suffer it is the innocent civilians that suffer the most. I just want to say this is the best case scenario. A business owner who is informed, aware, and an endorser. The reason why I wanted to share this conversation is for two reasons. One, this reminded me why I'm doing this, why I'm involved. I have a daughter. I care about her future. This is a big issue with a lot of parents, and especially the way our system and country is going. The second reason I wanted to share it is because this is a very rare, for me in my experience in the last 2 months, this is a very rare occurrence that a small business owner is that aware and informed. A majority of business owners are clueless about SB 562. They've never even heard about it. So it does take a lot more information, education, and advocacy to win them over. This probably is the first time they've ever heard of it. If you relay your information clearly to them, it's a good chance they will sign the endorsement letter that day. But in a lot of cases, you will have to leave information with them. They want to look it over, and you'll have to follow up with them afterwards. I think that's pretty much for that story. Also, one more thing. I did talk to a business owner today. It was a woman. She's been in the neighborhood for 25 years. I think I have stereotypes myself about small business owners because I think, oh, they own a business. They must be doing well. Well, she told me her personal story, and I just like felt so bad for her because she's a renter. She doesn't even own her own home. And her landlord just raised her rent, like tripled her rent. So she had to move out of the city to South City. Her business is in the city. She's worried about hanging on to her business. So when I think of small business owners, I feel like they do run the gamut in terms of their background and where they're coming from. But also I wanted to add that you don't have to be an expert on the finance and the budget part of this bill, because there are only few conversations that I've had so far with business owners where it went to the depth of talking about the finance part. If they understand that it's a benefit to them, this bill, if it passes as a small business, I think you kind of hook them in that way, and their ears listen, and they're open up their ears and they're listening to you. So I think that's pretty much all I wanted to say.
Great. Thank you.
Thank you, and you're a hero.
No.
We all look up to you. You're doing such a great job. We really appreciate it. They single-handedly brought in 5,000.
We appreciate all your support.
Yeah. Thank you. All right, I'm going to unmute. I'm going to put you back on mute, Ann, and we're going to wrap it up and open up for questions.
Okay.
So just hang on. So we just have one more slide, and then we're going to open it up for questions. You can type questions into your question box. And we just want to mention another resource. Some of you may have heard of the film Fix It. It was produced by a gentleman named Richard Master. It's a great film making the case for single payer, particularly from a business standpoint. You can Google this and find it online. You can download the movie. We have DVDs. It's a great tool to use if you ever can have a house party or an event. There's a 38-minute version available and also a longer version available. So I highly recommend you check that out. It's a very good film. And we're going to open it up for questions right now, and they're starting to come in. So let me got questions and comments. So Marike says, I recently spoke to a construction business owner of 200 employees. He is opposed to SB 562 and states that the government will still regulate his healthcare choices because they are the payer. I don't know how to respond. I would say that a response would be, so the way this bill is designed, basically all services are covered. All essential services are covered. And no deductibles, no copays, no nothing, no restrictions on who you can see. It's actually far superior to most insurance plans and to Medicare, actually. So that's really not a concern. The way to think about it as well, about freedom, insurance companies today control this, and they restrict your choices. And it's a complex, crazy system that does that. So I would say the response is, this bill is designed to liberate yourself from all that.
Yeah, and I would just simply add that there will be actually more choice. I can't understand why they would think that the care choices would be less. I mean, this is going to be a private delivery system whereby the physicians that hospitals are operating today can do so. I mean, essentially what's happening here is where the government is going to put in some more control is in establishing prices that are fairer for the consumers. I mean, right now, one of the reasons that we are paying twice as much as any other developed country for healthcare with worse results is because you have a stranglehold of the providers, of pharmaceutical companies that allow them to basically charge what they want. I don't understand at all why someone would think this would limit choice. Again, I'm on Medicare at the moment, and I have found that, and I agree with Dan that this is a better plan, but Medicare has really opened up incredible choice in terms of seeking out help.
That's great. I see Mary Kay just responded to our comments saying, I am a nurse. Your response is so accurate. I think he was afraid to change. So that's actually a very important point. I think one of the big hurdles on single payer is fear of change. You know, and it is a big change. It's a big change for the country. It's a big change for the state. You're moving to something new. People have a lot of anxiety about their health care. And a lot of people have distrust of government as well. So I think another way to talk about it is, you know, other countries are very happy with how their systems are working. Canadians, that consistently polls, you know, in the 90% approval or in that range of being satisfied with their system, not to mention France and England and a lot of other places. Even if they have issues, people prefer it much more than they do to the US system. So I think that's another point. So here's another question from Betty. You tried to say how many people Anne and NSF had influenced, and she drowned you out with laughter. Oh, I made a joke that it was thousands, but it wasn't really thousands. I'm not sure how many she got. I think it was maybe 10 or 20 or so.
No, it's probably higher than that.
Yeah.
I mean, I think in San Francisco, they've brought in like 30 or 40 people, which is great because it's, you know, it's not easy. But what they have found is that it is worth the effort they're putting into it because they're having lots of good conversations.
Yeah, and if you have a comment, you can type it in. So any other questions? Okay, now here's the question from Robert. Now they have a choice between several bad insurance options. With single payer, there's only one good choice. Problem is, it is too good to believe. Interesting comment. Do you want to?
No, I agree. I mean, you know, it is hard to believe that we've been deprived so long of something that should have happened. And again, well, okay, we're the only ones in the industrialized world that don't have that available.
Yeah, I think too. A response to that question is too good to be true. If one thinks for a moment about how screwed up our current system is, with, you know, a hodgepodge of insurance schemes and plans, profit being extorted at almost every step of the way by the insurance industry, by the pharmaceutical industry, and by the so-called nonprofit hospitals, we are wasting 20 cents on a dollar for profits, marketing, and administration. and executive compensation for for-profit entities. Now, other countries don't have that situation. Some countries do have insurance companies, but they're nonprofit, and they don't spend all the money on executive compensation and marketing and all that. So it's actually very easy to improve our system. It's not like it's too good to be true. It's actually a step in the right direction that's going to bring down the cost of healthcare for our country. This is one of the major benefits. It will provide care for everybody, but it will reduce our total expenditures as a country. We currently spend 18% of GDP on healthcare, just like twice as much as any other country. It's ridiculous. It's wasteful. It's extortion by monopoly control. This will address that problem. And once you break that, it becomes a lot easier to improve the system.
And along with that, I mean, I think it's important to talk to the business person and explain, well, that they're basically consumers of healthcare and that they are paying exorbitant prices for services that are not being rendered in a good way. What is the value that insurance companies are really adding to healthcare delivery? And I think they will understand that, if you're providing a service or product, it's got to have value for the consumer. And the reality is that a lot of these insurance companies are just sort of skimming the top because they can.
Okay, we have some more questions coming in. Dr. Bill has a question. How do you reach out to Rotary or Kiwanis groups?
Essentially, they can be found fairly easily in the community on websites and things like that. So it's possible to approach them cold, but it's also probably the best strategy is to try just to talk among friends or owners of businesses that are likely to be members to find some sort of connector in which you can talk to someone who says, yeah, that sounds interesting. I can raise that with the club or with the association. The reality is that a lot of these clubs have monthly meetings. It's usually some kind of luncheon that includes a presentation and a social gathering. And in some cases, they're actually looking for presentations that are business relevant and topical. And I think right now, especially between SB 562 and the new proposals by Bernie and the other Democrats in Washington, there's going to be a lot of interest to have a better sense of what single payer is.
Yeah, and I would just add to that, if you're walking on a commercial district and talking to shopkeepers or business owners, many of them belong to a Rotary Club or a Merchants Association, so that could be one of your questions. And if they're enthusiastic, they may, help set it up for you. So we have a comment from Anne. It's important to approach it as building a broad-based support and planting the seed for something we deserve and need our politicians to show leadership on, which is lacking in California. Thank you, Anne, for that point. California leadership is always a great point. Okay, we have another question from Betty. Did you say single payer is government bookkeeping? Please say more about that way of talking about it to help us answer questions about it. Well, one person that talked to Eric said it's not socialized medicine, it's socialized bookkeeping.
Yeah, I mean, it's kind of a joke, but it's real in the sense that you have to dispel the image that somehow the government is controlling the provision of healthcare and deciding what services are going to be offered. And in the end, what it really is a consolidation of a huge number of consumers into an entity which is managed financially by the government or by a nonprofit organization to get the best deals for that large group of consumers and be able to really make the system more efficient.
I would say it's really important to stress it's a private medical system. It's a private healthcare system. It's simply that there's a government, there would be a Healthy California Trust into which the funds would go, and that would pay the bills. So basically, it's aggregating in economics, they use the term buying power. And that's what enables the system to break the monopoly that is currently on hold of the insurance companies and so on. So it's simply centralized bill paying. It's not socialized medicine, and nor is it government-controlled healthcare. It's a private healthcare system. Very important point to stress because people get very confused about that. Okay, one more comment here from Mary Kay. I think it is important to tell people, including businesses, blah blah. I'm blanking on his name. And
I think you're talking about Warren Buffett.
Yeah, Warren Buffett.
From Nebraska.
That's right. Yeah, Warren Buffett. There's a video on our website, a little clip from Warren Buffett and his partner Charlie Munger, who basically say this country needs single payer. That is the tapeworm of American competitiveness. The exorbitant amount of money that businesses are paying for healthcare is hurting American business. So definitely feel free to quote Warren Buffett.
And I would add there that it's really important to understand that within business groups, there are different dynamics and different interests. And I think it's really important to explain and emphasize to small business people that the insurance companies really are not their friends. As I mentioned before, they're taking advantage of a monopoly situation to charge a lot for a bad service, and that doesn't work in the end.
Yeah. Okay. We have a few more comments and questions coming in. Let me kind of touch on these. Dr. Elizabeth Rosenthal wrote a great book, An American Sickness, which that is a great book. I read it. It's super great and very comprehensive. It gives the history of how healthcare became a big business and how we can take it back. So thank you for that comment, Mary Kay. And a question, how would I approach CEO of local small hospital about inviting you to speak? Betty, let's have a conversation about that offline. We did discuss that. I would say by and large, hospital CEOs are not going to be very enthusiastic about single payer because many hospitals are also in a monopolistic situation and they can charge prices that are insane if you've ever seen a hospital bill. So a hospital CEO probably would not be very sympathetic, although the medical professionals working in the hospital would likely be much more amenable.
I would also say, though, it's going to really vary case by case, because if you have, for example, a small rural hospital that is really not having sufficient number of patients because people can't afford to go to the hospital, then a single payer would really open up the possibility of a lot more people really taking advantage of the single payer to get the medical services they need. So it's complex, but certainly a small hospital, I think, is a much different situation than the Kaisers and others that are really controlling huge amounts of the hospital dollars and population.
Here we have a comment from Ann. I found merchants associations through initial contact with small business owners and network that way. So thank you for that comment, Ann. Okay, so there's a question about responding to owners who don't provide insurance to employees. Could Ann comment more? And if you heard that, maybe if you could just type in, or let me just unmute you for a second so you could address that. Oops. Okay, and you are unmuted. Did you get the question? It was about responding to owners who don't provide insurance to employees.
I don't get too many questions like that. I guess my position on that was, if they're not paying healthcare insurance now, this bill will actually provide healthcare for those employees who can't afford it, who work for them. So that's one less worry for them in that sense. And I guess that's pretty, I don't know, do you want to add something, Dan?
Yeah, I think that's a very good point. Yeah, it's still, I mean, they're paying health insurance, the owner, and so
right.
That'll take care of that problem. And then the other thing is it makes them much more able to compete with other employers that offer health benefits, right? Because if you're so many people, that's a big consideration of if they take a job. And if that's no longer a part of the equation, that increases their competitive advantage in finding good employees. That's probably from a
can I
business
just add one
standpoint.
more thing? Could I just
go
add
ahead.
one thing? What I found was for myself, when as an employee working for employers, and many times the employer would say, "Oh, we can't give you a raise this year because your medical insurance just went up," and so that
Right.
affects employees that way. And that's another good argument to say, well, you don't have to worry about that stuff if there is universal health care. And it does affect the bottom line for the employee as well as the employer. So.
Right.
And then there's also the element that many small business owners that don't provide insurance actually feel quite badly about that. They feel that they have, very loyal, good employees, and yet they're not able to provide for them as well as they would like. This will ease that problem entirely.
I came across a small business, a woman business owner. She was a hair salon owner, and I asked her about that, and she says she looked at her employees and she said, "I wish I could afford health care coverage for them, but I can't."
Yeah,
So,
there you go. Yeah, that's great. Okay, so Anne, by the way, we got a question here about if you're willing to share your contact information, because somebody needs help across that wants to. You don't have to do it to everybody, but if that's okay with you, Marike, you could email us and we'll put you in touch with Anne.
yeah, that's fine.
You're okay with that, Anne? Thank you.
Yeah, no problem.
Okay. All right. How do you answer displacing low-level insurance company employees?
Well,
great question.
The answer is that within the bill itself, there is a provision for retraining, and that people are very much aware of the fact that this will change. This will cause some displacement. So they're looking for ways to make sure there's retraining and an adequate period of time so that people can, figure out where they want to go in terms of their careers.
Okay. Are there any further questions? We're nearing the end of the webinar. Okay. Where is that in the bill? It's not in the DOPS program.
It's not specific, but I think in terms of the overall nature of the bill,
Yeah.
I mean, I'd have to go back and double check, but I'm pretty sure
Right.
there's some mention of that.
Yeah, I know one of the amendments that was submitted, but it hasn't yet gotten into the bill, had a plan for that, but it's not currently in the bill per se. But that's certainly part of the idea. It would not pass without that, because that's a huge issue. Okay. Oh, there's somebody says it's at the very end of the bill. Okay, we want that info. Okay. Okay. Well, we're wrapping it up here. I think the questions are tapering off. I just want to let you all know, probably by tomorrow, we'll post a recording of this session as well as a PowerPoint with all the things, and we'll be, repeating these webinars periodically, and we also do another one that delves more specifically into the business case for Medicare for All. That presentation and webinar is currently on our website as well. There is a tab under resources for webinars, so just check that out. And
we're also willing and happy to come out and have a group of people in your organization that are interested in getting more into this. We'd be happy to come out and do a training session so that people can increase their comfort levels. That's something that we can do. Also, there will be an evaluation attached to this webinar. We would appreciate if you could give us some feedback, because we're just kind of talking out into the atmosphere here, and we don't know if we're really meeting the expectations and needs that you have, and it would be very helpful for us as we continue doing these to really make them as useful as possible.
Okay. Well, Maureen, thank you for your thank you. Thank you all for joining us. We're very excited about this campaign. We'd like to have hundreds more companies signed on to support SB 562. I think it's pretty clear that everybody understands this bill will have a very hard time passing unless we can get the business sector on board. So it's going to take a village. Actually, it might take an army. I don't know, but you all can sign up and enlist yourselves in this fight.
We've had a number of people in business and outside comment that the business community is really a potential tipping point in this whole issue of achieving single payer in California. Again, it's a sector that has lots of clout, and it hasn't really spoken out clearly for in favor of for the thing.
Okay, just one final comment. Somebody asked about a Southern California contact. Robert, just email us and we'll put you in touch with, we've been in conversation with people down south. Sorry, one more final question, sample template or email. Yeah, I don't know. Do we have a sample letter to send out to businesses?
Generally speaking, we have taken more of an approach of trying to go to them directly, feeling that you know, these things are going to wind up in the trash. We could do that. It'd be very easy to do that. In fact, on the endorsement sheet itself, there's the basis for a potential letter that could be drafted quite easily that explains what we're about in terms of supporting SB 562 and why it's important for businesses to do so.
Yeah, I'm going to turn it on in a minute.
Hey, Ann, I put you on mute, but we can still hear you. I don't if you could put your phone on mute or be quiet in the background. There's a couple more comments coming in. Just we're going to close up in a minute. See, here's a comment that Bill Clinton told somebody that he meant, when are we going to get single payer? He said, when businesses figure out how much money they will save. Thank you. Thank you for that, Dr. Bill. Do not use words like this. I agree. That's just between us. Okay, all. Well, listen, thanks very much. We really appreciate your support, and we'll see you online or somewhere else.
Good night. We look forward to your comments and to working together. And again, we're very accessible. We're more than happy to receive phone calls, emails, and figure out how we can all do this together.
All right. Have a good night.